Hello, I'm Emma. I'm a mental health nurse in the Care Home Support Service, working for Oxford Health NHS Foundation Trust.
And my name's Linda Heward. I'm a ward sister on the post-acute unit at the John Radcliffe, part of Oxford University Hospitals.
We would like to introduce to you Knowing Me. This is a new form that will be used across Oxford Health and Oxford University Hospitals. This is a short clip just to give you a little bit of background to how we've reached this point and what Knowing Me will mean to you.
We were part of the first cohort of Dementia Leaders. This was a course facilitated by the University of Worcester, held in spring-summer 2013. The group consisted of nurses working in acute wards, community hospitals and district nursing. We also had physiotherapists, occupational therapists and a mental health nurse.
We were set a challenge to produce a patient passport type document that could be used collaboratively across Oxford Health and Oxford University Hospitals. The aim was that it was to be a recognised document that would improve the quality of person-centred care for people who are not able to express themselves.
The Royal College of Nursing and Alzheimer's Society have already produced This Is Me, so why reinvent the wheel, you ask? Well, we looked at This Is Me and another form called Forget Me Not, which was used by another hospital trust. We trialled each one of these with a patient and relative and fed back what was helpful about them and also the gaps, what was missing.
An important fact to us that the patient group that we care for often don't have a formal diagnosis of dementia, or that they may have had another condition that means they can't communicate effectively, such as a head injury, a stroke affecting their speech, or they might not speak English. Both the forms that we trialled didn't take this into account.
We discussed what we as clinicians need to know about the patient in front of us and what we wanted the form to look like. We wanted to know the person's likes and dislikes. This includes their diet, how they meet their personal care. We also need to know how they communicate distress and pain and what helps in these situations. We wanted a snapshot of the person's normal routine and to know what important aspects of their life, previous jobs, hobbies, etc., and also any religious or cultural needs.
The form had to be simple, succinct, sturdy and user-friendly. It was important to us that it was inclusive to all people who were not able to communicate, not just for people with dementia. We know that as busy clinicians we didn't want a lengthy form, as this would not get used. We wanted clear fundamental information about the person rather than a more lengthy document such as life history work. We also felt we needed to know contact details for the loved ones, the people who were important to that patient, and whether we could contact them at night.
So we designed a form that was given the name Knowing Me. OUH Charitable Funds printed 1,000 copies and we piloted this over 4 months. Changes were made from the feedback we received.
We now have funding from Oxfordshire Clinical Commissioning Group for 10,000 copies of Knowing Me to be made. The initial stock will be dispatched to all wards and departments across Oxford Health and Oxford University Hospitals. All nursing homes in the county will also be given enough for their residents. This is a joint venture across Oxfordshire with the intention for a single recognisable form that the patients will have throughout their hospital journey to aid communication and person-centred care.
Knowing Me should be completed by the main carer of the person, or indeed the person themselves if they have fluctuating disability or illness, which means that they cannot always communicate. Knowing Me must travel with the person, it's their property. We can use it to extract information though for person-centred care planning, to gain information to support discharge planning and general information to make their stay in hospital or the care home more individualised.
Copies of Knowing Me will be dispatched across Oxford Health and Oxford University Hospitals. If you haven't had copies, if your team hasn't received copies, please get in touch with myself, Emma Hawke, through the global email system. There will also be a supply of Knowing Me in the John Radcliffe, and to obtain those, please contact Linda.
Any feedback would be really gratefully received. We'll also ask for your support to get carers' feedback in the future. Future supply needs to be ordered through your department using the OMI reference on the document. Thank you, and we hope you find Knowing Me useful in your practice.